Thank you for joining us on Health Diary. My name is Gladys Gashanja, and today we're coming to you from the Nairobi Spine and Orthopedic Center. Now, those that are born with club foot, which is a congenital deformity, face immense stigma due to misinformation for a condition that can actually be corrected. Now, children born with this condition are ostracized, labeled bad omens, or products of witchcraft. Now, today we shed light on this condition and of course bust some of those myths and also understand how you can correct this condition. Right after this, fact of the matter. Clubfoot is a condition that causes a newborn's foot to appear to turn inward or downward at the ankle. It is one of the most common birth defects and occurs in males more often than females and can affect one or both feet. If left untreated, the child may appear to walk on their ankles or the sides of their feet. Treatment for clubfoot is recommended immediately after birth, but if left untreated, it increases the risk of long-term complications. Some famous people who were born with clubfoot include Damon Wayans, the American actor and comedian, and Steven Gerrard, the former English soccer player.
My name is Jennifer Wamboi Karanja. I'm an entrepreneur and I studied Bachelor of Arts in Theatre Arts and Film at Kenyatta University. Growing up with clubfoot has been very tough. As a child, I could notice that kids were a bit strange towards me because of my feet, so I never used to remove my shoes at all. And it has been very tough. I used to wear very funny looking shoes because the leg with my clubfoot had to have braces for it to be corrected. I remember there's a time I had to put my studies on hold for me to undergo several surgeries. I've undergone 6 major surgeries at different hospitals, but the last 2 surgeries are the ones that have been of major impact in my life because they made my leg more comfortable when walking. Because I remember I never used to go for swimming at all. I never used to go for pedicure. Those are things that I just used to, just let them pass because I was not very comfortable showing people my leg in public. But I'm grateful for having a very strong supportive system. I also had this fear when I was pregnant with my 2 babies. I had to do major ultrasound so that I can check whether my kids will be born with clubfoot because in my case it's genetic. I've never worn heels all my life. I've never worn open shoes. I only have to wear closed shoes that have laces or boots. People actually have never noticed. They always think that Jenny is Jenny's swag, but it's actually a way of blending in and looking looking good while still club-footed.
So the conversation today is about clubfoot or clubfeet, depending on how they occur. And to help us understand this condition more, we have Florence Wanjiku, who is a mother to Alba Macharia, born with clubfeet, right?
Yeah.
Yes, and we have Dr. Ezekiel Oburu, who is an orthopedic surgeon and foot and ankle specialist. Thank you for your time, Dr.
Thanks.
What causes a child to form clubfoot or feet while during their gestation period?
Most of the time it's idiopathic, there is no known cause. It just happens. Obviously, there are some things which predispose some children to getting it more than others. One of the things that predisposes is an element of genetic inheritance, and therefore there are certain syndromes that there's a good chance that a child may get clubfeet. And then there are certain things that, may predispose, like there's not enough fluid around the baby during pregnancy.
So at what point in pregnancy does it occur?
After fertilization and formation of the embryo, the bones start developing relatively early, from probably around week 5, week 6. And there are various theories about how clubfoot develops. Sometimes theories are the soft tissues around the bone may become contracted, or what we call fibrosed, or some theories postulate that some of the bones around the foot, the back of the foot, we call it the hind foot, one of the bones is a talus, that it gets arrested in development. So it does not quite develop up to point of maturity, but gets arrested.
Do you have any of your family members, relatives with this condition?
Not at all.
So
not
he's the
even
first
a
one.
grandparent. First one.
All right. Dr. I think this points also to environmental factors.
Reassure the parents, especially in our cultural setup. Sometimes when a child has club feet, something which can be corrected, to have normal feet. You can even become a marathon runner like Kipchoge if it's corrected early. The mother is blamed, and people say, oh, well, from my side of the family, nobody has this or that. Most of it is just idiopathic.
So are you saying maybe ingestion of alcohol during pregnancy or smoking has no direct effect?
It may have other detrimental effects, but not specifically for club feet.
Is there a possibility of actually detecting during pregnancy?
Yes, it's possible to detect it in pregnancy, probably during the later aspects of pregnancy, you can detect it. Because I think that one of the things that is important in club feet is really to counsel the mother that this child is going to develop to be perfectly normal as an adult if the treatment is early.
Okay.
So that would be the purpose.
Florence, when did you find out? At birth or during the scans?
After birth, immediately.
And did anyone explain to you what the condition was?
Yeah. They took their time. They explained everything about the club foot.
She has a son, and just reading on it, it says boys are twice as likely as girls to actually experience this condition. How come?
I don't think anyone has ever given an explanation as to why boys have a higher chance of getting club feet than girls.
But it is a fact.
No, it is
boys
a
are
fact.
more
Yeah,
affected.
it is.
So at what point in after birth do you start treatment?
Club feet, you start managing once the baby's feet are out. That is basically to say that, as soon as you can.
What does treatment, management, rehabilitation look like?
The proper club feet is managed by what is known as serial manipulation and casting. This is known as the Ponseti method, and it's a worldwide method. And what the child does undergo is a series of casting. Usually there are about 6 or so casts, where it may be changed every 2 weeks or every week. And what you're trying to do is to restore the foot to a normal position. After you do that, then sometimes the child may get what is known as a tenotomy. A tenotomy is just cutting a small tendon and bringing it all the way up. Then the patient goes into something very, very important. This is known as an abduction brace for the foot. This time the foot looks essentially normal, but to maintain this you need a period of at least 2 to 4 years. During the first 3 months the child will wear this for 23 hours. 23 hours, and they take a 1-hour break. And then later they would wear it every night for the next 2 to 4 years.
There is talk that at times using surgery, this could lead to probably arthritis later on in life.
When these patients present late, or sometimes even when they've been surgically treated early, they later develop complications, which leads to relatively complex operations where you have to do, because they develop arthritis in the joints at the back of the foot, what we call the hind foot, and you need to do extensive procedures. But all this can be, really taken care of if you're done Ponseti from the beginning.
Definitely, the baby is looking better and better by the day. There's a lot of hope. You're even smiling about this. How has that journey been?
At Pumwani, we are several mothers. So we used to sit after the calf and encourage each other. Yeah, that gave me the positivity a lot to move on with this journey.
When you go to either a mission hospital or you go to sometimes a government facility, you will get other mothers. And like we said, you need to wear these for 23 hours. If you get a mother who's on her third year, that's more encouraging rather than being alone and walking the journey alone.
Now, definitely the biggest impediment to rehabilitating a clubfoot or feet is the cost of it.
Clubfoot is not, the management is not surgery, really. The cost is not as high. Yeah, especially if you go to a mission hospital or a government facilities, really the cost is I think a pittance compared to what you would with regards to surgery.
Even the surgery?
Surgery is much more costly.
And is this something that's factored in maybe in NHIF insurance companies if you need to do surgery?
Yes, some of the insurance companies may not fully cover congenital conditions. Okay, NHIF would pay for part of the surgery, and it would depend on how much, depending on the facility.
There is a chance of recurrence.
Yes.
How come?
There is a chance of recurrence because you need to complete the full treatment. If you don't complete the full treatment, if you don't go for 3 or 4 years with the adduction brace, the soft tissues have not achieved a state where, they cannot easily slip back.
Florence, I know the baby is saying we need to finish this already, but just a word of encouragement for mothers who have children with club feet.
Have positivity. Ensure you have people around who are positive towards you. And let the candle of hope be lit always.
Very well said. Thank you so much, Florence Wanjiku, mother to a child who is undergoing rehabilitation, and Daktari Ezekiel Oburu, who is an orthopedic surgeon and foot and ankle specialist. And as you heard Daktari mention that physiotherapy is very, very important in the rehabilitation of a club foot or club feet. And we'll get to talk to a physiotherapist to tell us how the journey looks like and exactly what is done to ensure that they rehabilitate this condition. Earlier on, we were talking to Dr. Ezekiel Oburu, who is an orthopedic surgeon and foot and ankle specialist, and he talked about the importance of physiotherapy in the rehabilitation of his condition, and that's why we are now joined by a physiotherapist. You can introduce yourself and your specialty.
I am Nancy Nyambura Dirango, a physiotherapist at Nairobi County.
How or what is the role of physiotherapy when it comes to the rehabilitation of club feet?
We have 3 stages in Ponseti method of correcting clubfoot. We have the first stage, which is the corrective stage, where we cast. Casting is putting plaster of Paris on the foot, which we put and remove from the first day of birth to maybe the 3rd month, depending on how difficult and how easy it is to correct the foot. After we have corrected, we do something we call tenotomy, which is the 2nd stage of managing a clubfoot, which is done by a clinician who can be a clinical officer or a doctor, an MO, or even an orthopedic surgeon. After that, we go to the 3rd stage, which is called maintenance. We use something we call an abduction brace. This is an abduction brace which is locally made in Kenya, or you can have the imported one, which we currently have very few in the country because they are very expensive to acquire. This, if I import for you privately, it costs 30,000 and above. But if you start your clinic in Kenyatta, where they have some donations that are also limited, anytime they will run out, they sell it at 1,400. Which means after the child overgrows the brace, they change it and give it to another child.
And the ones that are locally made in Kenya?
The ones that are locally made are actually given for free by AIC Cure, which works with an organization called HopeWorks as a donor for the clubfoot management in the country.
Is there anything specific about the child that you have to consider before you know when to start the rehabilitation process?
Yes. One of the major signs that even you as a layman sees is that the feet are facing inwards instead of facing forwards. But as for me, a therapist, I will want them not just to face forwards, but to face outwards a bit. That is 70 degrees abduction.
Is that the normal way?
That is the normal way. Because even you, I would like at some point you look at yourself walking, even if it's not now. You don't walk like this. You walk like this.
Really?
Yes,
okay.
that's the normal. Yeah.
Interesting.
Yeah.
Okay, I was reading up on the fact that at times it's important to check if this child has any other condition they were born with, because at times some come with only the clubfoot, others have other neurological or congenital issues.
Yes. A good number of babies with spina bifida also have clubfoot.
And what's that?
Spina bifida is where a child is born when with the back, the spine, the lower back, not fully developed. And they often have residual paralysis of the lower limbs. So when they have the residual paralysis, the other thing they have is clubfoot, although not all of them, but a good number of them have clubfoot. It's a time when we have spina bifida that is open and that is closed. When it's open, there is a wound. We have to assess whether the wound can remain open or must be managed, as we also manage the clubfoot. But clubfoot, being a simple condition to manage, we often prioritize it. We manage the clubfoot as the baby goes home with a cast and continues with the spina bifida and the other clinics.
Okay, let's bring in Florence and Hassan so that we can also get to see what it is that you do as a physiotherapist when you're attending to your patients.
What we consider is the anatomy, the physiology, the features, the muscles around the foot. With a clubfoot baby, this part is deep. If you look at Alban, because we've corrected and he's now on the maintenance stage, there is no crease. But for clubfoot, you'll find a crease. There is a bone here called talus. Normally it is protruded and you can see its point, its head. We call it the head, but it's part of the bone. The other thing we check is called the lateral border. This border, we measure it with the pen. In a clubfoot baby, it goes inward. So we do not have the lateral border because the foot has gone inward. So we measure it that way. The next thing we check is the posterior crease. In clubfoot, this tendon, which is called the tendon Achilles, is shortened because the foot is pulled this way and this way. So we measure how tight it is and how the crease, because of the tightness, we have creases behind. The other thing we check is the rigidity of the inguinals, which is the folding. With a clubfoot baby, you cannot go upward. It is very tight. It is very rigid, actually. And that is why we have to do a tenotomy later to release it. The next thing we check is the emptiness of the heel. You palpate the calcaneal bone, you can't feel it in a clubfoot baby because it is far inside. And we do that weekly. We remove the cast, we correct, reassess, and score. And when we are sure that we have dealt with everything, apart from the tightness of the tendon Achilles, that's when we go to stage 2. We call in a clinician who does a very simple procedure called a tenotomy. Actually, a tenotomy is just like a cut in the kitchen because we actually do it on the couch with local anesthesia.
When you're dealing with an adult, how complex does it get for you as a physiotherapist?
When we are dealing with an adult, we have to use the same score for us to decide. But today, they are encouraging us to start with casting. Because once we put the plaster of Paris, we are able to manipulate the bones and to lengthen the muscles that are very tight because of the deformity position. And in case, because they obviously have to go for surgery eventually for adults, when they go for surgery, it becomes easier for the surgeon to achieve what they want to correct in the theater.
Okay, does it take longer to rehabilitate an adult than a child?
It does. It does. It does take very long. Although in medicine, not just clubfoot, each case is individual and typical of itself. Yeah.
Okay, so many mothers out there do not even get the help that they need or bring their children. Others because of the myths surrounding this. And how much of that is an impediment to getting these children to you?
If I can give you a practical case scenario of one of the mothers we had, the husband told her, kwetu hatuzai viwete. That was the word. And she was crying, and fortunately, the baby's foot was one of the simplest. It corrected so fast. We didn't have hitches with sternotomy. We did the sternotomy, and the baby is now on the abduction brace. And the father is now very proud of the baby and the mother. So we're having a lot of challenges, and more awareness needs to be created, because clubfoot is one of the simple, reversible disability in the world. What I would encourage the African community, and Kenya in specific, is to effectively use this booklet. This booklet, if you go to page 22, it talks about identification of impairments and disabilities. But how many health workers, even the mothers, read this book?
And it's something that is used during antenatal?
It's something that is available for free.
Where?
In all government hospitals. And as everyone is picking immunizations for their clinics and their hospitals, they can also be issued with these.
All right, very informative conversation. Nancy Ndirago, physiotherapist, thank you so much for shedding a lot of light around clubfoot and feet and what it takes to actually rehabilitate. And of course, our baby who's gotten very tired during the conversation, but at least it was good to see that this is possible. Thank you for your time. Time now for the health tip.
Vacation season is here. We'd like to offer you traveling tips, specifically the mom and baby. We have the pain and fever management systems, which include syrups. Then we have a thermometer. You'd like to carry the forehead one, which involves no contact. Babies don't want touching during the traveling season. You might want to carry a band, which is put on your hand and caters for the motion sicknesses. We'd like to offer you a teething solution, which comes with a bib that doubles up as a teether. We have different types, also with an attachment that you put onto the baby's wrist and caters for the same. We have wipes and sanitizers. We have sunscreen specific for infants and toddlers. You can get all these items from any Good Life pharmacy. We are all about you.
Yet another informative episode of Health Diary, even as we learned more about clubfoot and how to rehabilitate the same. We have been coming to you from the Nairobi Spine and Orthopedic Center. My name is Gladys Gashanja. Until next time, see you. They are ostracized, so to speak, and the libido, it was going very well. Happiness?
Not really. Not really. Maybe that surgery, after surgery.